Good afternoon, everyone, and welcome to today's Fireside Chat, Emerging Topics in Health Promotion webinar series. This webinar is hosted by Health Promotion Ontario, which is a volunteer-based organization with a mission to promote the health of Ontarians through excellence in health promotion practice. HPO is currently has a membership campaign and is also looking for members to join its executive committee. So please visit their website for more information about that. There will also be an annual general meeting coming up soon. You can watch for the initial announcement, or you can email HPO to learn more about it or to be put on our notification list. And keep an eye out for their soon to be launched new Health Promotion Ontario website. My name is Andrea Bodkin. I am a health promoter at Public Health Ontario, and I am thrilled to be part of today's webinar as your moderator. I am coming to you today from Public Health Ontario's offices in downtown Toronto, or Takaronto, which is in Treaty 6 territory and the traditional territories of many First Nations, most recently the Mississaugas of the Credit. The Mississaugas of the Credit are not just a historical group of people. They exist, live, learn, work, and play on a reservation in Haldimand County, as well as off reserve. They're a band of about 2,500 members. We have participants today from all around the province and beyond Ontario. So I invite you to take a moment to consider the First Nations, Inuit, Métis people in your area, their history, the present, and future. So the purpose of today's session is to hear stories from health promotion practitioners from around the province, and we have three wonderful leaders who are driving innovative health promotion initiatives that you're going to hear from today. But before we dive into the webinar, just a couple of housekeeping items. We are recording the webinar, and the recording will be available on Health Promotion Ontario's YouTube page following the session. Give us a little bit of time for editing. And if you have questions for any of our panelists today, we have a Q&A box which you'll find on the bottom of your screen. We will answer questions at the end of the webinar, but you can ask them at any time. And if you're having any technical issues, please email Amanda for any assistance. So for the fireside chat today, we're going to have some short video presentations from Courtney, Erika, and Liben, and then we're going to have a little bit of a fireside chat, a little bit of a conversation before we go to questions from you. So our incredible speakers for today are Courtney Kupka, who is a health promotion evaluation professional and a mixed method community-based researcher focused on addressing health inequities, using evaluation and research to support evidence-informed decision-making. Currently, Courtney is a research and evaluation coordinator at Access Alliance Multicultural Health and Community Services. Erika Aelterman is a public health promoter passionate about building environments where young people can thrive. She coordinates Planet Youth Temiskaming, an evidence-based prevention initiative that empowers communities to reduce youth substance use by strengthening protective factors in families, schools, and neighborhoods. And our final speaker for today is Liben Gebremikael, who is the first executive director of Taibu Community Health Center. He's led the organization for the past 15 years. Today, Taibu has a strong community roots and has become a recognizable agency that is committed to addressing the impact of anti-Black racism on the health and well-being of Black communities. So let's hear from our speakers.
Hi, my name is Courtney Kupka, and I'm the Research and Evaluation Coordinator at Access Alliance Multicultural Health and Community Services. Today I will be speaking about our practice-based model for conducting community health needs assessments. To provide an overview of our center, we started as a grassroots organization in 1989, and over the last 35 years have grown to serve 3 main locations across Toronto and thousands of community members. I would like to acknowledge that the work of Access Alliance takes place on lands that belong to many Indigenous nations, including the Huron-Wendat, the Anishinaabeg, the Haudenosaunee, and the Mississaugas of the Credit. Our organization provides accessible, community-governed, interprofessional primary health care for immigrants, refugees, and their communities. Our mission is to provide services and advocate to improve health outcomes for these individuals who have been made vulnerable by systemic barriers and poverty. Following the community health center model of care, we focus on 5 service areas: primary health care, illness prevention, health promotion, community capacity building, and service integration. The learning objectives for my talk today include understanding the Access Alliance model of conducting community health needs assessments to generate evidence on needs, assets, and concerns of the community, and the best practices for engaging diverse communities, including newcomers and immigrants, in the spirit of community development. I first want to start with defining what a community health needs assessment is. It is a process that identifies and describes the needs and assets of the community to identify priorities which facilitate evidence-informed decisions for programs, services, or advocacy efforts aimed at improving factors that contribute to the health and wellness of individuals and the community as a whole. At our organization, it is our planned practice that community health needs assessments are completed every 4 to 5 years in the communities that we serve. This allows our organization and our partners to stay tuned to the evidence-informed needs, assets, and concerns of residents and service users. To go about this, Access Alliance has developed its conceptual framework for implementing this work. There are 3 phases to our conceptual framework for a community health needs assessment. The first, which is the most important and time-consuming of the phases, is the ideation phase. Here you will focus on team building and designing the project. It is important to be clear about what your intentions are for the project so you can keep your scope within reason. The key outputs of this phase include a developed project team with specified roles, a robust advisory committee that are representative stakeholders, which you can use a stakeholder analysis to support, a demographic profile outlining the characteristics of the community that you serve, and a complete project plan including the scope, methodology, tools, data collection plans, a data analysis plan, along with a knowledge mobilization plan. The second phase is the implementation phase, and this is about engaging with clients and community residents in an ethical manner. It is important here to have a heterogeneous or a diverse recruitment to hear different perspectives of community members and residents. The key outputs of this phase include a trained project team of data collectors. Your advisory committee and other community stakeholders are engaged to support the data collection. You are implementing the data collection for your respective methodologies, whether that be survey, focus group, or other methods you're using. Once your data is collected, you engage in a collaborative data analysis process. And then finally, your knowledge mobilization products are developed. This might include a report, presentation, infographic, or any other knowledge mobilization products that are easiest for your knowledge users to use. Finally, the utilization phase is the last phase of this process. It includes a report back to your community members, residents, along with advisory team members. You're going to incorporate this information into your final knowledge mobilization products and ultimately share the information widely. So your key outputs of this phase include the community advisory committees are engaged to review and validate the findings. The products are updated with feedback from these sessions, and your knowledge mobilization plan is implemented by sharing with community members and other relevant stakeholders. They can then use this information for evidence-informed decision-making and quality improvement processes. Throughout all of these phases, you will have ongoing consultations with your advisory committee members, and this can be through information sessions or co-production of knowledge through ongoing consultations. Some best practices to consider when engaging with diverse communities. Two of the most important points here are to assess and understand your position in the community and to clearly outline your scope and intentions. It's very important to be clear with what your project is trying to achieve. When we're collecting information, just because something is nice to have doesn't mean it is need to know. So be considerate about the information that you're gathering and therefore holding. Finally, consider what your clients and community members require to participate fully. For example, even across our 3 sites of Access Alliance, our service users differ greatly by cultural and linguistic groups as one factor to note. For us, it is important to have peers or community health ambassadors who are representative of the communities that we serve and who can engage in real time with clients and community residents throughout all phases of the project. A community health needs assessment plays a pivotal role in community development by identifying and understanding the health-related needs, priorities, and assets of a community. It provides valuable insights that can guide community stakeholders, including local authorities, healthcare providers, nonprofit organizations, and residents to collaboratively address health disparities and promote overall well-being. This graphic depicts what is actually a cyclical process for community health needs assessment, but how evidence can be generated and gathered and how it's instrumental for community development. As mentioned, the Community Health Needs Assessment serves as a foundational tool for community development. It empowers communities to proactively address health disparities, strengthen partnerships, and promote sustainable initiatives that lead to improved health and well-being for all residents. The routine and periodic implementation of community health needs assessments at Access Alliance allows us to be continually adaptive to the needs and concerns of community and creates evidence to be catalysts for change at the micro, meso, and macro levels of our system. Thank you for listening today and feel free to reach out with any questions. We're currently in the midst of our community health needs assessment at our Access Point on Jane location located in the west end of Toronto. However, you can check out the Our Clients page at accessalliance.ca for our more recent Taylor Massey Oak Ridge community health needs assessment products that are present there. Thank you for your time and attention, and I look forward to answering your questions.
Hello everyone, my name is Erika Aelterman. I'm a public health promoter with Northeastern Public Health. My role is to coordinate the Planet Youth approach across Timiskaming District and to support our local coalitions and steering committee. Happy to be here today to share our work and some of the key lessons we've learned from working in the upstream prevention and community development space. The Planet Youth Timiskaming is based on the Icelandic prevention model, which is an upstream approach that's used all around the world to reduce youth substance use and improve well-being. It uses local data and community collaboration to strengthen the environments that shape young people's lives. So we look at 4 main environments where youth are spending their time: with their family, at school, with peers, and their leisure time in local community. We start with a survey of local teens to understand their daily lives and identify where our communities can focus our efforts to help youth thrive. Our first survey was in 2023 and included 555 students from all 5 district high schools, and it will be repeated every 2 years to track progress and guide action. Planet Youth is coordinated by our local public health unit and is guided by a district-wide steering committee. While Planet Youth is a district-wide initiative, it is really based in the local community. So the approach we've taken is to develop 3 local action teams across our district that use the youth data and community input to plan initiatives in their region. From this work, we've identified priority areas that focus on increasing positive leisure time activities for youth, strengthening youth sense of belonging and connection to community, and increasing awareness of the protective factors that help youth thrive. We were very fortunate to apply for and receive funding from the Public Health Agency of Canada for a 30-month period to support our project implementation and evaluation. So today I won't go into the details of our local data, our action plans, or even our key interventions. This information is all on our website. Instead, today I want to share some of our challenges, successes, and lessons that we've learned from working closely with and in community. So early on in our process, we did some work to map community assets, both with youth and within our action teams, to identify the strengths within our communities that we could build on. One action team invited community members to share their skills with youth through workshops. And the response to this was really great. Everything from outdoor cooking to sewing and felting workshops, with more to come. And this has been a low barrier way for young people to try new things and to connect with local caring adults. Overall, we found parent engagement to be a little bit challenging in this work, and we're hearing that from other community partners too. We know that parents are super busy. However, we have found some really great involvement from seniors, retirees, and grandparents, a population that can be overlooked but really does have a lot to contribute, and this has been a real strength for us. Our local action teams also act as idea incubators. So for example, when a local parent and teen wanted to find a place to play basketball, we supported them to find a space, promote, and organize a free 12-week drop-in program in a local school gym. It was so popular that they'll be running it again this winter, giving young people a positive activity to do in our colder months. Another example is a young person that needed a little bit of support to start a Dungeons and Dragons club. When brought out to the local action team, a local church leader stepped up to offer space and some support to get started. So these initiatives have been some of our most successful and the most rewarding because they are community-led solutions. Across our district, we have 24 municipalities, which for the most part are really quite rural, and transportation remains a wicked challenge for us. It's a topic that seems to come up at every community table, and when it comes to increasing access to positive leisure time activities, we knew that this transportation barrier wasn't something that we could reasonably expect to solve or something that's even really within our scope. Knowing this, we shifted our focus to community empowerment and local action through the Youth Activity Fund. This project, the Youth Activity Fund, we offered microgrants that help youth and community members start new accessible activities for young people or improve existing ones. There really were a wide range of projects, everything from hosting different activity try-it days to installing a graffiti wall at a local skate park. A really cool example is the Active Living for Youth project, which allows low-income youth to access one of the local recreation centers in our communities for free. All of these activities are getting youth engaged in their local community, building relationships, and encouraging them to explore their interests. All of this work just would not be possible without the support and collaboration of community and local partners. Through our work with the action teams, we have learned that having a paid and protected position to help lead these teams and provide coordination support is really essential. It's just not realistic to ask partners or volunteers to add this role to their already full plate. So now we're at a stage where we're looking at ways to designate roles within each of our 3 zones that are paid and protected to help keep up momentum in each community between meetings. We've also been able to take advantage of a few windows to influence change and conversations about building more supportive community environments. While alcohol policy isn't articulated as one of our top priorities, it has been important for our teams and our steering committee to notice these opportunities and to be ready to act. So there have been a few policy levers that we've been able to support, so community conversations about licensing hockey arenas, as well as advocacy challenging the recent retail alcohol expansion, as well as just advocating for support for upstream approaches. At the same time, change often starts at the community level and in challenging community culture. So what's seen as normal at local events and arenas, and even in how we celebrate things as a community, when alcohol messages are everywhere, it reinforces social norms and also what's acceptable for youth to see. So for example, in one of our communities, there were plans to use champagne flutes at a high school prom. After some conversation about the message that this might send, the idea was dropped. So this is just a small but important step toward shifting culture and creating healthier spaces for youth. Our teams really work together to share data and best practices so that when a window opens, whether it's a new bylaw, a funding opportunity, or a local concern, we have the tools and the language to advocate and empower community members and partners to do the same. Community work can be challenging, but it's also super fun and rewarding. We know that prevention work takes time, sometimes years and decades to show results, and much of the changes that we'll be able to measure will be seen over the long term. And this can be tricky when there's pressure to deliver results in a short time frame. So I like to try to remember and talk about the small wins and take moments to celebrate these with our action teams and with our steering committee. So everything from a parent who felt heard at a parent cafe, a youth who participated in a local action team or a workshop and returns again to the next one, a municipal leader who starts using upstream language and advocating for preventative approaches in their work, or a community member who's been empowered to share their talents with young people. These are all proof of a culture slowly changing, even though they don't always fit neatly into a report. So if you're looking for more information, I've linked our website and Facebook page, and I thank you so much for your time and attention.
Hello, my name is Liben Gebremikael, and I'm the CEO of Taibo Community Health Center. We serve the Black communities across the Greater Toronto Area, the residents of the Malvern neighborhood in Scarborough, and Francophone communities in Scarborough and beyond. Today, I would like to share with you a conversation or have a conversation with you around health promotion and particularly health promotion for Black communities. So I've titled this presentation From the Bottom to the Top of the Cliff, and you will see why I've chosen that title. I've just shared with you briefly who we are as an organization and our vision and mission and our values here. But let's talk about health promotion. Let's talk about health promotion. What do we mean by health promotion? Particularly when we're talking about, vulnerable population, disadvantaged population, population that are experiencing discrepancies or disparities in health and social outcomes. And I would like to use this analogy called the cliff analogy. I first heard this from a very known and very engaging physician and epidemiologist from the United States called Dr. Kamara C. Jones. And the idea is we have people, community members, populations that are falling down the cliff because of various factors, what we call the social determinants of health. And usually the system responds at the bottom of the cliff, right? So at the bottom of the cliff, we're seeing a lot of people being impacted by health conditions, by social issues, and we're saying, okay, we need more ambulances, we need more hospitals, or we need more police to address these issues. But, health promotion, though, is really about looking upstream and looking what's happening on the top of the cliff and maybe doing some, putting some measures in place. And that could be a safety nets to stop people from falling. And, that could be, around injury prevention, for example, right? Health promotion activities that are targeted to reduce injuries and stuff would be described as a safety net. I think a better health promotion perspective would be to put a fence or a wall at the top of the cliff so that people do not actually fall over the cliff, right? So that would be a very good measure, a health promotion measure. But better still, I think another effective health promotion is actually to drive people away from the cliff. And so we're talking about maintaining good quality of life and things like that, so that communities can be healthy and do not are exposed or predispositioned for various challenges. And so, within the context of social determinants of health, we look at everybody who's impacted by these determinants or factors, and then we plan and design a health promotion plan, a promotion activity, right? But for communities such as the Black community, Indigenous communities, newcomers, refugees, immigrants, Francophone, this approach might not be fully effective. And the reason is because we know certain communities are experiencing social determinants of health, in different ways, probably in more disproportionate rate of incidence of certain conditions that apply, whether it's income, unemployment, all those kind of things, mental health, access to services, things like that. It is more challenging for certain communities to have those things. So I think that is the lens that Taibu uses, and that the lens that I am also sharing with you here. And we have very good reasons. This is a map of Toronto, which demonstrates where the Black community is particularly residing, you know, Scarborough area and the Northwest area. And you could overlay different maps of different health and social status outcomes over this map, and they would all fit nicely and focused on those two neighborhood areas. And I will show you some just to kind of demonstrate what I'm talking about. But if you took the COVID-19 incidents in the city of Toronto, you will see those two darker areas. It is where COVID really hit hard. And so more Black and racialized communities were impacted disproportionately compared to other visible minorities, racialized population, but also definitely when compared to the white population, right? So this is average income, and you will see here, at least for 2020, the Black community was doing far worse than other racialized communities or the general total population or the white communities, obviously a significant disproportionality. The same thing here in terms of living in poverty as per the market-based measure, you will see the Black community significantly impacted at 16%, comparatively higher than any other communities. This is a demonstration of Black population living in below standard housing. If you remember the previous map I showed you, you can overlay that map around here and you will see the two most impacted areas in Scarborough and in the Northwest, and particularly the Black population. This is a measurement around early childhood development, and you will see again these two areas that are darkest, where it's showing, for example, 28 to 44% of children are at risk to being vulnerable around communication skills, cognitive development, social skills, and stuff like that. And then finally, we can also talk about food insecurity and where we see the Black population. And this is about, children who are impacted by food security, the highest among all racialized population, but definitely compared to the white population. So when we're talking about health promotion and social determinant of health, if we just looked at social determinant of health, we would really miss some of these particular elements where we have to have a separate, focused, targeted strategy and plan when we're doing health promotion activities. And that's why we want to talk about the social determinants of equity, which is the same thing. Everybody is falling down the cliff, but there are more Black, Indigenous, Francophone, newcomers falling down the cliff compared to others, racialized groups, or definitely the white population. And so our lens should shift, our perspective should shift, our planning and focus should shift from the social determinants of health approach to the social determinants of equity approach, where we're able then to think upstream and put those measures, whether it's injury prevention, putting a wall or a fence on the top of the cliff, or moving people away from the cliff with that lens of equity. And that's what we've been trying to do at Taibu in developing different programs and services. We have a model we call the model of Black health and well-being that has three main goals of prevention, restoration, and advancement. But within that, and with all the other principles and practices that we have, we embed African-centered values, traditions, ways of doing, ways of being into the work that we do, so that we can really connect to how Black communities should be served, or what outcomes we should be looking at. And I can talk, a lot about this, but some principles, for example, would be collective responsibility, which is what we call ujima, or self-determination. And all what we do, which is a principle of health promotion, is to empower and build the capacity of communities so they can self-determine what they want as their, or what well-being and health looks for them. And that is the work that we need to do. And a little bit of, discussion is around how the system works and how health promotion should be thinking differently is also how the system is built. We know the system here in Canada, education system, healthcare system, criminal justice system, child welfare system, all those kind of systems were designed for a certain set of people or communities or a society. And because of this, there are certain communities that are further marginalized because the system was not designed with them in mind. We're talking about the indigenous communities, we're talking about the Black communities, we're talking about the refugees, right? And the immigrants. And the system is, because of how it is designed, is putting people on the margins and not at the center. And how do we then move people from the margins to the center? We've started doing some work, over the past 5-6 years after COVID and George Floyd and Black Lives Matter movement. We have opened a few doors and windows here and there, through EDI initiatives and stuff like that. But the center and how the system has been designed has not changed. And part of health promotion work should be able to change what the center looks like, how things are designed, and how we can engage and include other people's views, other people's cultures, other people's tradition into the system thinking, so that if we do that, then we can have a proper inclusion of the different values and traditions and views of health and well-being, which is health promotion. Within the Black community in Taibu, we talk about the Afrocentricity or Afrocentric ways of doing things. And Afrocentricity actually just means that people of African descent are moved from being just spectators of systems and activities and services and become active agent about their self-determination of how health and well-being should be designed. And that is the work that we do when we talk about health promotion, moving from the bottom to the top of the cliff. And finally, I think it's very important that we also talk about community engagement, because without proper community engagement, and actually at Taibu, we're moving from the term of community engagement to community empowerment, because many organizations are focused on these three, left side spectrum of the community engagement around, consulting, informing and involving community members, and move to the right side of the spectrum around collaboration and empowerment. And particularly, how do we work with communities to empower them so they can become active participants, agents, and also people with informed decision to decide about their own health and well-being, which we call for us the self-determination for communities, right? And many of you would have seen this, the different kind of models, the medical model, the charity model, the social model, whereby, is everything done is to us and without us, or everything is done for us and without us. Maybe closer would be nothing for us or about us without us. But mainly, this is where we want to be, that we work with the community so that they can decide. And so the principle would be by us, for us, with us, right? Some people call it the asset-based community development. At Taibu, we call it the Ubuntu model. Ubuntu is a Zulu word, which means I am because we are. And it is the description of the interconnectedness of humanity to come together and do something good for us as a group, as a community, and as a society. I'll stop there. Thank you very much.
Thank you so much, Courtney, Erika, and Liben, for those terrific video presentations. We're going to dive into a little bit of a community conversation, and I'll give everyone an advance notice that if you do have questions for any of our presenters, you can use the Q&A pod, which you will find at the bottom of your screen. So please feel free to get those questions in while the four of us talk a little bit. So there are a few threads that pull all of your stories together. And one of them is community engagement or community empowerment, as Liben just said. Often we are looking to engage communities that we label as hard to reach. And I think I can say that all three of you work with those groups of folks. So, how do you reach the communities that you work with? How do you reach those hard to reach folks? Lieben, do you want to get us started?
Uh, Thank you, Andrea. Actually, we have challenged ourselves with this, notion of or how we describe certain communities as hard to reach. And we have realized actually we're the ones who are hard to engage. And so we've flipped the script for ourselves. So, at Taibu, even from the beginning of Taibu, it's been 17 years now. Like one of the first focus that we really wanted to do was develop a trusting relationship with communities. When you're looking at it from a service and saying you want to engage people for a certain program or services is different from where you want to say, I want to develop a relationship, period. And this relationship has to be trusted. And so we've used that kind of perspective to build that relationship slowly so that now once people check us out, when we are at their level, when we are where they are, and we're not asking them to come to our program services, but we are saying, we're here. How do we do this together? What do you need? And then build that relationship. I think it becomes then easier for them to guide us, to show us, to let us know how we should be moving. Most of the time we do programs, we do the planning, we are the experts, and we create those kind of things. We prepare the flyers and then we invite people. And there is also this notion about, if you invite them, they will come. We've also flipped that script at Taibu because we don't invite them. We start with engaging them and building relationship. And then there is no need of invitation because they're already there. And they are, using our space, our services, our thinking, our resources to shape what needs to happen in the organization from their perspective.
So it sounds a little bit like the approach, Erika, that you're using with Planet Youth, because I'm fairly certain that you didn't sit down and say, let's have a felting program or let's develop a Dungeons and Dragons club. And it sounds like the youth came to you with those ideas.
Yes, I feel like I'm going to echo a lot of what was just said. And for us, it has been more about figuring out how to show up differently and finding the right way to get in and make engagements meaningful and successful. And it's a lot of trial and error too. Like we still don't have all the answers and we learn a ton every day. We found that a lot of it comes down to building relationships and actually being present in the community. So relying on just a formal meeting once a month, it really isn't enough. So having those consistent, familiar faces in the community out there chatting with youth, with schools and partners between meetings works a lot better for building and maintaining engagement. So that's what's worked really well for us is connecting through people who are already trusted in the community. So I'm thinking of like one of our municipal partners who has a really strong relationship with youth in the local schools. So she'll be in there at a moment's notice, just chatting with youth or the principal, or a youth champion who will make school announcements or connect us with other youth groups. And these champions are already trusted, so their words carry a lot of weight. And this really helps open doors and it just makes engagement more meaningful and also more sustainable.
So, Courtney, I think we probably all imagine that it's really difficult to engage people in our programming, and I'm using a lot of air quotes here because we're breaking down a lot of these terms. But engaging people in data collection sounds like a completely different challenge. How do you approach that with the folks that you work with?
Yeah, thanks, Andrea. I would have to echo what Lieben and Erica have mentioned. And I think just to go back to what Lieben has mentioned, flipping the script on the idea that people are hard to reach. You might just be one looking in the wrong spot, or perhaps you're not that trusted person in the community. And so I think something that we value at Access Alliance and pride ourselves on is we have built that trusting relationship over time and becoming part of the community, not just as service providers, but being that place that clients will pass and then say, oh, let me pop in and go check in with this staff. I think that comes down to clients referring to programs and services not as our arts program or youth program, but by our staff's name. So it will be Lana's program or Sylvia's program. And so I think that in and of itself, that speaks for itself in volumes for sure. But when we're doing data collection, yeah, that's a great question because I think a lot of communities do experience that extractive type of data collection. So I think approaching it from a different side of we're not just there to extract information, but we're there to engage and empower community members in the process itself. So we don't really stop at just, hey, here's a survey, give us everything you want us to know, and then we'll take it from there. Don't worry. It really is more of a collaborative process in that we continue with further discussion and conversation in those, continued discussions. We ask about what do they want to see happen. So it's not us taking this information and developing what we think the solution might be, but really hearing from clients, how do they perceive this solution to be? Because they're really the experts in what's going on in their neighborhood and the day-to-day life. And when they come to Access Alliance, we're a part of that piece. But what can we do with our clients and community members on a broader scale?
So
Can
there's
I just
different.
add?
Oh, please, yes,
Sorry,
Liben.
sorry, Andrea. No,
No, no.
maybe that will be helpful for our attendees here. Is a working group has done a lot of work around developing what we call the EGAP framework around data collection and data governance. And I just wanted to throw that out so that people can look at it. EGAP is engagement, governance, accountability, and protection of data from Black communities, something similar to the ONCA principle, the indigenous principle that exists. And so there are some tools that people can use in order to make sure that when data collection is involved, which is a sensitive issue, because data has been used to further marginalize and criminalize certain communities, that there is a framework that they can use to help them collect the data in full participation of communities. I just wanted to throw that out there.
Yeah, thank you for that. And I think a few of the words that the three of you use that are really important, all three of you talked about trust. And I think we're all very familiar with the concept of building trust with communities, with partners. We've often heard or used the phrase that relationships move at the speed of trust. But another thing that the three of you talked about that I don't know that I hear about a lot, and that's being present and being consistent with that presence. And I think that with the groups that the three of you work with who experience marginalization, who have experienced exploitation, who have experienced, extraction, to use your word, Courtney, with data, that presence and that consistency of presence is incredibly important. I wonder if anyone can build on that theme a little bit.
I'm a gentleman, so I'm going to wait.
Sure. Perhaps I can start us off. I think I can speak for our organization in a nonprofit setting that can sometimes be difficult based on some funding structures that we experience and the nature of some funding cycles. But I think it's being very strategic and conscious about how we're implementing programs and services for sustainability. And that's what allows our engagement and connection with the community to thrive over time. But also our ability to adapt and respond to the interests of the needs that clients and community members express to us. So making sure that we're offering programs and services that really are meeting the needs of communities, and going back to this idea, not the what we feel are their needs, but what they're telling us their needs are. So, for example, if this is various clinics that we offered, such as our non-insured walk-in clinic, we have a wonderful open door program that provides screening by going to community events for various diseases and illnesses that folks may experience. So, I think that that's one piece of it, is being sustainable, continuing to be visible, and connecting with our clients and community members over time.
Yeah, I echo a lot of that. Like at the beginning of the school year, one of our action teams, we sat down to refresh and we said, this is the year of follow through, of being present and saying yes. So, at the beginning of this project, it was before we had the action teams, it was tricky because we wanted to be out there in the community, building relationships. But it was mostly just me doing that work, which is hard to be everywhere all at once. So now that we have these action teams, we can really work together to have more of a consistent presence in the community and be at different community and school events, student council meetings, community powwows. And that's made a huge difference. And again, just building our visibility, building trust and relationships. That's been huge.
I don't have much to add. I think it's been well described, but communities have their ways of trusting and checking out if our engagement is genuine or not. And how we can do that is by being transparent, very open, put our organizational vulnerabilities out there, but then being there very consistent and showing some action, right? When people are asking certain things and showing some action. And I've seen that when that is there is transparency, there is honesty, there's consistency. It helps very much for people to engage. Many of these communities, as we know historically, have trusting challenges, and so we need time, we need consistency, we need openness and transparency to help them come closer to us. And then the other thing, when they're closer to us, is also continue to share, the power and the decision making and putting ourselves accountable to what they're requesting.
Thank you so much. So I'm just taking a look at our Q&A pod, and I'd like to encourage our participants to put any questions that you have for any and all of our presenters in the Q&A pod. And I believe that you can post anonymously. So if you prefer to keep your name to yourself, you can certainly do that. So we challenged each of you a little bit today by describing your work as driving innovative health promotion initiatives. So what do you think makes the work that you do innovative? Where does your organization or your drive, your inspiration, where does that come from? Maybe we'll have Liben start this time.
So I think for us at Taibu, as I described in my presentation as well, is that and as I said earlier on, in terms of our approach to health promotion, letting community drive the process. And right now, I think that we're seeing the success, and we're actually struggling with space, for example, when we have events or programs, because the communities are there with full participation and in numbers. They're very engaged. They don't see Taibu as an organization where they come to participate in programs and services. They consider Taibu as their space, right? So they're very vested, they're very protective of the organization, and they're very vocal. So if we're not doing what we're supposed to do, I will be called to the principal's office and they will have a word with me. That has been very successful for us. We're really very, very excited all the time. I can give you several examples, maybe a couple, particularly with our Ubuntu project, which has engaged a lot of seniors in the community to be active, to be facilitators of programs and services led by the seniors, planned by the seniors, and delivered by the seniors. One example I usually give in situations like this is during COVID, when we had the shutdown. Like we've been working very hard to get seniors out to participate in programs and services so they are not isolated. And then suddenly we were telling them, go back to your house, don't come out, like stay isolated and stuff. So we as a team, the health promotion team and the community program team, um, we decided that maybe we should have the seniors that we know who are very vulnerable, have mobility issues, are isolated, that we do wellness check with them on a weekly basis. And we call and would see if everything is okay. Do they need anything? Do they need shopping done and things like that? I even volunteered to get a couple of numbers so I can also call, just to kind of to show them that we are thinking of them during this period. And then one afternoon, I got a call from one of the seniors in the Ubuntu Elder Council. And I was like, my first expectation was, oh, okay, so and so is calling me. Let me answer the call. I think there's something that they need. So I make sure that I would respond to their request. And we exchanged a few pleasantries. How are you doing? Are you okay? Like on both sides. And I was waiting for this person to tell me, oh, we have this problem to be sorted out. Can you help? And that was not forthcoming. So at the end, like after a few exchange of how are you doing, how are you doing, I asked and I said, okay, so how can I help you? And this person said to me, oh, no, no, we're just doing our wellness check. The Ubuntu Council has decided that we will share the numbers of staff. And we know that we are at home and safe, you are working. So we're doing a wellness check. And I said, you must be joking. And this person said, no, 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 no. The council has distributed numbers of different stuff and we're calling to check on you. I think that for me was very like deep. At that time I said, if we have done anything right, I think the trust building and the empowering of communities to be, engaged in what we do was significant. Another example, and then I'll stop. Very recently, where we're located, there was a McDonald's cafe that you seniors used to use for their, morning. They would go there, they would sit down and chat. That's their social network space that they do, and it closed. And so they came to us and they said, look, McDonald's is closed now. We don't have our social coffee space. Can we start a cafe here at Taibo? And so it's been now maybe a couple of years, 2 years now, that they have on Thursday morning, they have their cafe. They come, this all volunteer led by seniors. They're, organizing and it's not funded. So they're getting, support from here, donations from there. And so they have the cafe, they have coffee, tea, very light, fresh, fruit and stuff, breakfast. And they sit down and they chat. Some of them play dominoes, some of them do crosswords, and they just chill and relax and network, and then they go. So they're very active. They are, I think they have been empowered to do what they want to do for themselves. And so I think those are the kind of things that, keep you going and saying like, this is really very exciting.
Mm, that's wonderful. How about you, Courtney? Where do you get your inspiration from?
I think for myself, on a personal level, in particular, when we do community health needs assessment projects, we're going beyond the surface level indicator, and we're really exploring more than our population health epidemiological statistics. So we're not just saying, okay, this percent of people in the neighborhoods that we're serving are underemployed, or this percent are experiencing this. We're really looking at the why in behind that. And so, for example, one of the key pieces of information that came out of our recent community health needs assessment was around employment as an example. And it's not just that folks were underemployed in the sense of the employment rate, but they were underemployed in the sense of their credentials. So the folks that we had engaged with really expressed, they're well educated, well trained. And then when they immigrated to Canada, it was like all of that work had disappeared. But really, it doesn't. There's such a underutilized and a lack of empowerment of folks who have this education and experience from wherever they may come from back home. And then in Canada, like I mentioned, it's not acknowledged in our structured, and I'll use your air quotes, Andrea, in our structured systems. And that's really disappointing. And that goes beyond the unemployment percent rate, right? That tells us a lot more better information in terms of how we can address those employment rates. So how can we better our employment related services? We have a particular group called our Immigrant Insight Scholars, where we have internationally educated researchers and medical professionals, and we're supporting them in transitioning their career into Canada, whether that's seeking alternative credential routes, if they want further education, whatever that may be. So I think that for myself, in terms of community health needs assessment, is being able to go beyond just those surface level percentages and rates that we often hear about, and really understanding what would benefit people in terms of their own assets and needs that they have.
Mhm. Thanks, Courtney. What about you, Erika?
Thanks. I feel like the work we're doing with Planet Youth is really innovative because it's really focused on the upstream factors. It's true upstream prevention. So rather than focusing on telling youth how to change or what to do or what not to do, we're working with communities to create an environment that makes it less likely that they'll use substances, and they'll be more likely to grow up and be healthy and happy. Um, and Planet Youth, it's used all around the world and across Canada. It seems to be growing bigger and bigger every day, but it really looks different everywhere because it's adapted to each community's needs and local context. So it's not a one-size-fits-all approach, but it is really inspiring to see other communities doing this work, the creative things they're doing, all of the knowledge sharing between us. And there have been some really cool facilitators that have made this work a bit easier for us. So for example, like from the start, our organization, our health unit has really supported this approach. They've trusted us to lead it as health promoters, to lead with flexibility and openness, which meant a lot of letting go of control and letting community lead, which has been like challenging, but also really cool. And another facilitator was that the community was really ready to step up. So this didn't take a lot of convincing for our community to undertake this approach. We've had some really great early adopters and early supporters, from our school boards to our principals and like different local champions that have helped this approach take off. And it's great that we're at the point now where we're seeing some really cool, tangible results.
Great. Thank you so much to each of you for your presentations, for this discussion. We have some questions rolling in from the audience. And first, this is one of my favorite questions. I'm so excited someone answered it, or asked it rather. Have you ever tried something that failed or didn't meet the expectations that you had for it? And if so, how did you come back from that failure? Did you change your goal? Did you change your approach? How did you come back from that?
I can start. So something that we're doing that I didn't really touch on today is we're piloting like a floating youth hub. So it's kind of like a youth drop-in space in 4 of our communities across the district. It happens once a month, and it's like it really depends on community volunteers to come together and make it happen. And in some communities, it's really taken off. It's been really successful. And that's been really cool to see. Like, again, we're learning so much every day and like tweaking it as we go. But in some communities, like it just hasn't taken off for whatever reason, whether it's like the space we've been using or the time, the day, maybe like we're not the right people to be leading this. Maybe that's not what they actually want. We misunderstood somewhere in the engagement process. So that's where we're at now. It's like trying to understand like what are the pinch points, and are we going to be like tweaking this further to see if there's a new way this could work, or are we going back to the drawing board? So I think it's just like it's listening and it's staying open to things not working and being ready to change.
Yeah, I think it's also the same experience. At the beginning, we never got it right. But I think, what helps us for us is, as I mentioned earlier on, some of the principles that we are trying to embed in the philosophy of our service delivery. That helps us to kind of shape what we do. So since the adaptation of our model of Black health and well-being, we are much better because we're thinking, what are the principles that we need to think about: the collective responsibility, the purpose, the unity. Those kind of principles helps you to kind of then guide your next steps or action plan that you want to take. But we had challenges. We had programs that didn't take off at all, that we didn't have, the right number of people to start a program. Sometimes also, maybe mentioned a bit earlier on, is sometimes the structure of the funding and how it is given also could be a challenge. So we have to kind of create some creativity around how do we make sure that this would meet our community needs. There has been times when we have said to our funders, this is not helpful. What you're giving us as a direction or stipulating certain limitations would not help us to engage with our communities. We need some flexibility, you know, and funders are not always, eager to change certain of their limitations, but we had to push back to explain to them how communities engage with us and saying we need this kind of change so that we're able to do that. So we've learned lessons. Now we're able to kind of even give guidance to our funders to say, we know this is not going to work. We need some flexibility here.
Just a final example for myself. I'm not a direct service provider, but in terms of our projects and data collection, I mentioned in my presentation, we try to, with community health needs assessment, we're not just wanting to speak with our clients or folks who live in, a 1 block radius of our centers, but we're really trying to reach further out into the neighborhoods and the communities that we serve. And part of that process is engaging our partner organizations. And we had this idea that, asking our partner organizations to collect or speak with 10 to 15 of their clients and respond to the survey would be a great idea. They're the experts with their clients and they're familiar with their clients and community residents as well. And that turned out to be a challenge in terms of time being able to spend for our training and engage in terms of the process. And so we really found that there was more of a collaborative approach where the service providers at the partner organizations really welcomed us in terms of our data collection team and helped us to connect with their clients and folks that were attending their service provision locations. So while that's not a super, flashy example of how something went wrong, I think it's a beautiful way to show how partnerships and adapting your response to some challenging situations or hiccups even can be really, really helpful. And then I think I also saw another question in the chat in terms of, data collection or not having or meeting someone who doesn't want to take part in your data collection? And that's such a great question. Again, I think it goes back to this trust-based topic of conversation around, do you have trust with your community? Do they trust you with the information that they're providing? But also, just because someone doesn't want to engage with a survey doesn't mean they won't engage with a conversation. So really changing and opening up your mindset to, it doesn't need to be a survey where they're checking off a box or 100 boxes on a piece of paper, whatever it may be, but welcoming that conversation side of things or different approaches like arts-based methods, engaging clients in or respondents in a session, and you're creating a beautiful image or piece of artwork and having folks speak and engage that way. So really being open to how you can adjust your methodology in terms of connecting with individuals and hearing from them.
So what I'm hearing from all three of you is the notion of flexibility, that it's that old adage, if at first you don't succeed, try again, but don't try the same thing. Try it in a different way. Be creative with that. Thanks for those answers. So here's the next question. It's another great one. How is lived experience incorporated into your frameworks? Or how common is it to have leads with lived experience in the areas of data collection, for example? And also, thank you for your reference to the EGAP or AGAP framework. Who'd like to start us off with this one?
I can start us off. We're currently in this process. I'm not directly working on this project, but I have two wonderful colleagues who are Marco Campana and Isa Jalil. We're currently working towards a newcomer health framework at the organization and seeking partnership and collaboration in that. So, it goes beyond just engaging our so-called experts, who we typically refer to as service providers. And that the definition, I think, of expert really needs to be expanded, because we're one side of things, and not all of us have direct lived experiences. And even if you do, your experience from someone else's can be quite different, even though you may fall under an umbrella together. So I think it's about continued conversation and engaging folks in your processes of developing frameworks. And it's an iterative process. So it's not just a one-time consultation. It's, hey, share with me what's your experience. What do you think this should look like? Let's do the work and draft something and bring it back. You tell us if this is right or wrong. Are we on the right track? So really engaging in an iterative process and using stakeholder analysis. Again, stakeholder, I think, can be another limiting term where we typically find that this is service providers, maybe industry leaders, things like that. But your true stakeholder analysis will allow you to uncover who should be at the table, and that will guide an appropriate process development.
That was a very comprehensive answer, and I don't know if there's anything that I can add to it, but just a thought that was going through my mind was, the idea of lived experience and how we should be mindful, right? Because sometimes lived experience can be used to not fully engage community members, because we think that, because we have lived experience, that it should be enough. So just being mindful of what we mean by lived experience and how lived experience can be used to further engage communities, right? So, and not just to keep it, or the lived experience is the expertise we have, and so, right, we're good. But the lived experience is helpful to even engage further, and like the stakeholders, the communities, the people who are impacted at the bottom of the cliff. So I just wanted to throw that out there.
Anything to add, Erika?
Yeah, something that came across my mind is just like I was reflecting on how when we're trying to create like a healthy, supportive community for youth, like everyone is a stakeholder. Like everyone can have a role in that, whether you're a teacher, a parent, a business owner. They're all things that we can do to make our communities like better, safer, healthier places for young people. So yeah, just like anyone and everyone who's got an interest in this is welcome to the table. And it's been cool to like empower people to come to the table and say, no, this is like, you can do this. Like, this is your role too. And we're happy to have everyone participating in it.
Just wanted to mention that the Tamarack Institute, that does quite a lot of work in community engagement, they refer to interest holders, which is an alternative term, as content and context experts. So content experts are often people who are employed at an organization or a service provider, someone like all of us, whereas a context expert is someone that could have that living or lived experience and or has familiarity with the context of that particular audience. So I just wanted to throw out those two useful terms as well, content and context experts. So another great question from someone in our audience today who thanks everyone for your informative presentations and says that the concept of power seems to be very important to all three, to the work that all three of you are doing. How have you navigated the power difference that exists between your organization and the communities that your organization serves or works with?
I will start here, and for our context, that has also been one of the, context and perspective from the organization, knowing that the communities that we work, the Black, Indigenous, Francophone, refugees, immigrants, are, communities that have essentially no power when it comes to systems navigation. And so we are always mindful of how that space is being negotiated. So when we're talking about, that's why we're using terms deliberately around not community engagement, but community empowerment. And community empowerment is not just about giving training to communities and building their capacity and stuff like that, but it's also looking at how decisions are being made. So as I was explaining about the Ubuntu village concept that we have, and one of the things that we had to be mindful, including me, was that if we are saying that this is going to be a community-led, empowering, initiative or movement, then we have to make sure that we are true to what we're saying. And so I had to stop myself and also tell to my team when they come to ask me questions about, oh, this is being suggested, can we do this and should we do this? And I'm saying, changing my mindset and say, is this a decision I have to make, or is it a decision that can remain with the Ubuntu Council, that they make the decision? So we had to learn to say, if there are no legal consequences, if there are no health and safety implications, we don't have to make the decision. They can make the decision, and then we will support the decision. So we had to deliberately work, within our own way of doing, because it's very natural. It comes very natural to say, okay, we're going to make a decision. And so I had to stop myself and say, I don't need to make a decision. Bring me recommendations or challenges or decision questions if there are some legal implications, if there are some health and safety concerns or reputational risk for the organization. Otherwise, giving that power back to community is something that we had to do intentionally. And sometimes it's challenging because, when you give power and space to communities, they will take and do what they need to do. So when they come and challenge us with decisions, another example I will give is earlier on, we used to stop our community programs and health promotion programs in June. School ends, so there's a lot of childcare situation, and so programs become a little bit complex. So we used to stop our programs in June, and communities came and said, so where do you think we'll go from June to September? right? What is your decision based on? And so we had negotiation. They got a petition of about 100 people sign a petition and come to my office. And so we had a conversation, and I said to them, we need some time because staff also need to take some vacation during the summer. We also have to have a break to plan for the next cycle of the program. So we negotiated, and now it's been a few years. We stop our health promotion programs end of July. We give our staff some break and community some break in August, and then we come back. So if we're ready to give decisions and power to the communities, then we have to be prepared to entertain that, and that again builds this trusting relationship that they have, right?
So we are almost out of time, but I want to hear just quickly from Erika and Courtney about this, about power and how you navigate that.
I can start. Yeah, there's a lot of different ways to think about this. It's the health unit is leading this project, for example, or is the backbone organization for this project. But it's really important that the decision-making power lies within our steering committee and within our action teams, so that we're not making decisions on their behalf, even though we're the coordination admin backbone. And then from another perspective, like we had a youth engagement training this year and we learned about sharing power with youth. And like that is a skill in and of itself. Like it's, my instinct to just like step in and save young people or save them from doing the hard work. And like, no, they can do hard things. They're skilled. And so it's a practice learning how to share that power and give that power.
Yeah, just to add, I think Liben and Erica covered it quite well, but I think one part of it that I don't think they explicitly said, but they did express is it's understanding your locality and position in the community and what that engagement looks like. And I think they both put it so eloquently. It's okay, let me stop myself. I need to step back, and this is not my position. This is not my role. This is not my decision, whatever it may be. And so I think that is a key part of it. And it's, that's a conscious decision. I think by nature and default, we want to make decisions. We want to help and engage just based on the work that we do. But taking that second and saying, Lieben, I think you said like, I need to wait. Is this for me to make in terms of a decision or in terms of a move? So I think that's a key piece is just consciously taking a breath.
Thank you so much, everyone, for attending today's webinar, and to the three of you, especially Erika, Lieben, and Courtney, for sharing your expertise, your enthusiasm, your innovation with our audience for today. Please take a moment, those of you who are on the line, to click on that link for the evaluation survey or to use your phone and scan the QR code. You can answer it later, but just click to open that link up for you to give us some feedback. We do this series of webinars every year or so, and your feedback really helps to inform what we are going to do next time. Thank you again, everyone, to our presenters, to those of you who are here on the line, to Health Promotion Ontario for giving us this opportunity to talk today. And you will see the video recording of this webinar on Health Promotion Ontario's YouTube channel very soon. Thank you so much, everyone, and please enjoy the rest of your day.